Welcome to the Journey to Prosperity for All. My name is Shaquan Gill. I'm your host, and this is a program where we look at and review the programs, activities, and initiatives of the PPPC government over the last 2 years. And with me for this conversation, I have the Minister of Health, Dr. Frank Anthony, in studio with me. Minister Anthony, thank you for taking the time to talk with us.
Well, thank you very much for having me on the program.
Minister, firstly, I want to ask you, what was the health sector like upon your assumption of office in 2020?
It was very challenging. I think in a lot of ways it was in a terrible situation because you would recall when we took over, you had a raging pandemic and we were ill prepared for the pandemic. So immediately we had to start putting things in place to be able to manage the pandemic effectively. So we had to um, get testing equipment, bringing more tests to be able to test persons for COVID 19, um, decentralized testing. We had to create capacity for the management of patients, create hospital space. We had to complete the Ocean View facility because you would recall that was open twice, but when we actually got into government, we realized that there was no electricity, no water, no sewage, no beds, not a piece of instrument in the building, yet it was declared open. So we had to do a lot of work to get these things up and running. And to be able to manage the pandemic um, in such a way that we can reduce cases, reduce deaths, and reopen a lot of the services in the health sector because when we were managing COVID and hospitalizing patients at Georgetown Public Hospital, it meant that a large part of that hospital could not function, especially the ICU, because we had COVID 19 patients there. So it was absolutely essential that we shift our ICU operations to the Ocean View Hospital and reopen the Georgetown Hospital so that we can start normalizing the functions that we would normally have there, the services we would normally have there. So it was a uphill task, um, but I think we have been quite successful in putting all the requisite infrastructure, equipment, training for people so that we can have better control, not just of the pandemic, but with some of the other major illnesses.
And so you spoke extensively about putting things in place and bringing the health sector back up to standard. Um, After that point, how would you gauge the health sector's performance over the last 2 years?
Well, I think we have been improving, and in different areas we have done different things. So our trust is to improve. I guess it's for the general public to assess how well we have done, over the last 2 years. Another big problem that we had when we took over, apart from dealing with pandemic, we had severe shortages of medication. And you would recall that in the materials management unit, we had to dump close to 10 billion Ghana dollars worth of expired medicines. So while medicines were probably bought, it was not distributed. There was chronic shortages across the country. So that's something that we had to really work on to make sure that we bring back adequate supplies of medicines. And so that when people come to a health center or a hospital, they're able to get medicine. So um, looking at what we had then to where we are now, we still don't have 100% of all that we need, but we are probably about 90%, right? So we have come a long way over the last 2 years.
Dr. Anthony, I know you have had the opportunity as well to interact with a number of persons that have been accessing the public health sector over the last 2 years. And tell me, how has the reaction been and how has the delivery of services improved and these persons' experiences in the health sector over the last 2 years?
I think people are getting better access. backlogs that we had for surgery and things like that. We are working to clear them. So more people are now able to get their surgeries. More people are able to come to the hospitals and get a shorter waiting time for some of these things. Uh, by no stretch of the imagination have we solved all the problems. There are still issues that we have to grapple with, but it is getting better, and it's more improved than what we had 2 years ago. So I would say it's a work in progress, and we have set our sights on specific targets that we would like to accomplish. We have spoken to the management of these institutions. We have set these targets with them, and we are working to achieve them. So we are not managing in an ad hoc manner. We have specific targets that we're looking for, specific indicators that we would use to judge how we are improving. And the management of these facilities understand that, and we use this as measurements to see whether or not we are improving. And if we see one of the indicators are not where it should be, we'll let the management know, we'll do reviews, so we're actively working to improve the system, and it's not just in Georgetown, but across the country, because we want our hospitals and health centers to function in a much better way.
And talking about the targets that you've set, and many of those that have already been accomplished in between the 2 year period frame, what are some of those major accomplishments or achievements of the public health sector under your purview?
So I think in terms of some of the achievements, if we look at infectious diseases, for example, we have done a lot of work on HIV, and during the period of the pandemic, we have seen some of the patients dropping off. They're not coming for treatment, so we had to work to make sure that these patients stay on treatment. So that's something that we have worked on. Treatment now, antiretroviral treatment in Guyana is free of cost. We have introduced over the last year PrEP. There's pre-exposure prophylaxis, so anyone who want to access PrEP, they believe they are vulnerable or at risk for an infection, they can come into any one of the HIV clinics and be able to access this medicine. We have also introduced self-testing for HIV. So these are new innovations that globally it's being recommended that we go in this direction. So we have started moving in this direction. And more recently, we had a team from Belize and other persons from the Caribbean that came to Guyana to see what progress we have been making on self-testing, and they want to adopt some of the strategies that we have done here to take it back to their country. So we were very pleased to host them because we are leading in this area. In terms of TB, we have been working with our TB patients to make sure that they have adequate medication, and that has been progressing quite well. We have set our sights on 5 diseases that we like to eliminate over the next couple of years. Our outer target is for 2030. So we are looking at the elimination of filaria, for example, leishmaniasis, Chagas disease. So all of these we have sat, we have developed plans, we have put some resources to make sure that we can accomplish elimination, and we'll be rolling out some of these, and you will see the published plans with the indicators over the next couple of weeks. So we have done quite a lot of work. So infectious disease, we believe many of them we can actually eliminate, and those that we can't eliminate, we can control them. We have done a lot of work in malaria. As you know, there are endemic regions in Guyana where we have malaria, so regions 1, 7, 8, 9. And we have distributed bed nets. Over the last 2 years, we have given out more than 52,000 bed nets to families. And this was free of cost. Miners, mining camps, We have given them hammock nets, for example, because that is more compatible with the environment in
Yeah.
which they're living. And, and we have also been able to train a number of people in these mining camps to diagnose malaria and to be able to give the medicines for malaria, in that way to help to reduce the burden of malaria in these communities. So we have done quite a lot of work on the infectious disease side, the more prevalent ones, and hopefully we'll eliminate some of them and we'll control others and bring the numbers down to a minimum. On the chronic disease side, these are diseases that, because of lifestyle, people would have them. So we're talking about hypertension, we're talking about cardiovascular diseases, we're talking about kidney diseases. So these are a set of diseases that we have, the persons come to clinic and we treat them. But a lot of the preventative side, that work was not being done in a very systematic way. So we have put together plans to be able to do prevention, as well as those persons who are already affected to be able to put measures in place so that they can get effective treatment. We have introduced a program called HEARTS, and with HEARTS you help to reduce the risk factors and update the treatments that you're giving. So HEARTS, by the end of this year, would be in 83 health centers across the country.
Oh.
They'll be following a totally different protocol, and we have the medicines to be able to follow that protocol. And our hope is that in the next 2 years or so, this system would spread across, or the treatments that we're giving for HEARTS would be across the public health system. And we anticipate we'll get better outcome, better control for these different types of disease states. We are also in the process of completing a diabetic center, the first of its kind. It's going to be a one-stop shop where all things relating to diabetes, you would be able to get there. So you come in, the doctor would see you. If you need to do an eye test, they'll be able to get it right there. You need to have your feet looked at because of insufficient blood flow. They would have the relevant persons there to look at that. If you want nutrition counseling, they'll have somebody there to be able to offer that. So under one roof, you'll have all the services relating to diabetes. And we think this is important because right now, if someone who is diabetic can come to one of the clinics, they'll have to go somewhere else to get a laboratory diagnosis. They'll have to go another place to be able to, to get other types of services. So by having it in one place, we expect that we'll have more compliance, better management of these patients. And with diabetes, we anticipate that it affects more than 60,000 persons in Guyana. So it's quite a large number. And I think if, as we anticipate, the successes of this particular center, once we see that it's a successful model, we'll want to replicate that to other communities. But we are starting. Other things that we have done, we have looked at, infrastructure, because a lot of the infrastructure that we inherited was really run down. And so we have invested, for this year alone, more than $1 billion Guyana dollars, upgrading infrastructure for health posts and health centers. On average, in every region, we have spent close to $100 million in upgrading infrastructure. So most of that work is completed. Some of it still remains. So by the end of the year, we'll be able to finish, upgrading these facilities. And the upgrade include enhancing waiting space, putting in sanitary facilities, and things of that nature. We have also started, we had started doing some work on a few of the smaller hospitals. So for example, at Diamond, we have completed that work. That's now what is called a smart facility because we are reusing rainfall. It's not prone to flooding. We have added solar panels so that some of the equipment that we have there can be powered by the solar panels. We have also completed the upgrade of Letham Hospital. We have finished Mabaruma. We'll open that shortly, maybe within the month we'll be able to do that. We have completed Lenora, and that one too will be opening shortly. We have also been working at Parmakatoi, so that one by the end of the year we should finish that one. So these facilities are now upgraded. We are able to do services that we weren't able to do there before. In Mabaruma, apart from upgrading the hospital, we have also added other facilities. So we have a training center in Mabaruma where we can now train community health workers. We have added doctor quarters so that we can send physicians up and they'll be able to stay not far from the hospital and give services at the hospital. We also recognize that in several of the district hospitals that we have, especially in the hinterland, many of these district hospitals did not have theater capacity. And so one of the projects that we've had over the last 2 years is to add surgical theaters to these facilities. So we have done at least about 4 such theaters. Some of them are already operational. Others by the end of this year would certainly be operational. So small surgery or minor surgery we'll be able to do at these facilities. We have also, as you recall, at one point we had what was called a National Ophthalmology Hospital. When we were in government before, we had done this project jointly with the Cuban government. Over the last 4 or 5 years of the APNU, they had really allowed the place to run down, and nobody could have gotten surgeries there. The theaters were really in a mess. The operating microscopes were non-functional. So we have done major upgrades of that facility, refurbished the theaters, put in new operating microscopes, and we have now restarted the service. So much so that we have a program now where we're going into different communities, especially in the hinterland, screening for cataracts. And once we identify persons who have cataracts, we put them on a list, then we fly them out, take them to Port Morant, we operate there, and then we send them back to their community. Since we have started that program this year, we probably have seen close to 100 people. And so this has brought a lot of relief to those persons, and we are going to continue that, and we expect that over the next couple of years, we will be able to address far more people that have these eye conditions. So we have been very busy doing a lot of things. For mothers, for example, one of the challenges, especially with mothers in the interior, is that they have to travel long distances to get to the hospital. Right. So if they wait until they go into labor and then come to the hospital, by the time they get to the hospital, they probably would have delivered along the way. And sometimes that's not necessarily a safe thing to do. So in most of our interior hospitals now, we are developing what is called waiting homes. So the mother can come, the expectant mother comes to that waiting home, would wait there a couple of days. Once they go into labor, they move from that facility, which is in the compound, into the hospital, deliver there safely, and then you go back into the waiting home, and then you leave and go back to your village. So we have a few of those. We have developed one in Region 9. We have in Region 1. We are doing some in Region 7 and 8. So this would help to ensure that we have safe delivery, especially in the interior communities. So there are lots of things that we have been doing.
Minister, there are 2 particular initiatives that I want to open for discussion, one of which is the dialysis program that has been set up by the Ministry of Health to basically assist persons who have to get dialysis. And that has happened over the 2-year period. How successful has that program been, and what has the reactions been like in relation to that?
So dialysis is necessary for people who have end-stage renal failure, and it has been challenging for those patients. Many of them probably are diabetics, and they end up with end-stage renal failure. But now that their kidneys are not working, they need to be on dialysis at least 3 times a week. And that has been very costly and challenging for many of these patients. We had under the last government, they were giving to each patient $360,000 as a one-off payment. So when you're diagnosed with end-stage renal failure, they'll give you the 360 and that's it. Now, $360,000 would not buy you a lot of sessions, because the cost of a session ranges from, let's say, 10,000 to maybe 20,000 in some facilities. So you're not getting a lot of sessions. And you would need to be on dialysis for the rest of your life, pretty much. So with our program, what we have done is to offer to these patients $600,000 every year. So it's not going to give you all your session for the year, but it's going to be substantially much more. And it's not a one-off, it's recurrent. Every year you'll get this help. So for this year alone, since we have initiated the program, we have given in excess of 200 patients this $600,000. And I think from the reaction of most of the persons who have benefited is that they welcome this intervention by the government, because many of them were in severe financial difficulty trying to get access to dialysis services. Sometimes if they need 3 times a week, they're only going 1 time per week, and which would really not be ideal for them. So this came in as in many ways like a lifesaver for a lot of people, and they have commended the government for introducing this program. So I think it's a really good program, and we continue to work with these patients. But while we do that, we are also starting a campaign to get people to understand, so if they're diabetics, to make sure that they have their diabetes under control so that they don't end up with renal failure. So we want to do more of the preventative aspect. But those persons who already have renal failure, we are going to continue to assist them.
Of course. And Minister, the second thing that I wanted to speak on, or the second initiative rather, is the distribution of hearing aids that the ministry has embarked on. Tell us a little bit about that program and how beneficial that has been so far.
So previously, the ministry has been working to screen people with hearing impairments. But a lot of time, the persons who have these hearing impairments, when we diagnosed it, they were then required to pay for their hearing aids. And again, that's a costly thing. So imagine a lot of old people who probably got hearing impairment, and then you're asking them to pay $50,000 for a hearing aid. So that's challenging for a lot of people. So as of this year, we have removed the fee that is normally charged for the hearing aids, and we are now giving persons who require them free of cost. So far, we probably would have completed maybe about 200 or so hearing aids. Yesterday we were in New Amsterdam. The day before we were in Region 5. We gave, I think in Region 5, 18 persons got hearing aids. And yesterday we probably did about 30-something persons in New Amsterdam. So we are not only confined to Georgetown, we have our teams that are going out to different communities, and we screen and then we fit the hearing aids, and that is very important. For this year, we intend probably to do about 800 hearing aids, and we'll budget additional sums of money for next year so that we can continue the program. I think again this is a very very good initiative for especially persons who cannot afford buying a hearing aid on their own. That this, you know, when you give somebody a hearing aid, it makes a tremendous difference to them, and you know, improve their quality of life. So this is one of the programs that, you know, we have been pushing quite a lot and in various communities. Another thing that we have been doing too, there are persons, in some cases, some of them might be diabetics, who did not manage maybe a diabetic ulcer properly, and they ended up with an amputation.
Mm-hmm.
So those persons now need prosthesis. But the cost for prosthesis, if they have to pay for it, is probably going to be between $300,000 and $400,000. So we are now working to remove that cost and to be able to do the prosthesis for persons who require them. At least bring down the cost to a very minimum. So that's a work in progress. We haven't been able to remove all the costs as yet, but we are working to do that very shortly. So there are lots of projects that we have been working on that benefit people directly. We have another one that would be started shortly to go into communities and we test their eyes, and we'll be able to give them snap-on spectacles. So we have all the material already. This year, our rollout, we would be able to give at least 5,000 people spectacles using this format. And so by the end of the year, we intend to use up the 5,000 spectacles that we have brought in to distribute to people. But we'll do that first by testing your eyes and then be able to give you these spectacles. We also have a school program that we're working on with the Ministry of Education, where we'll be going into schools, screening kids, checking their eyes, checking their mouth to see if they have dental problems, checking their ear, you know, because sometimes you will have a child with these difficulty. If they can't see properly, then they wouldn't be able to learn, or if they have a hearing impairment. So if we correct that early, then they would learn like a normal child. So we're starting this program to screen across schools, and hopefully we can identify these children that, you know, we can help, and we can help them early so that they don't have any learning difficulties.
Minister, finally, as we wrap up our conversation, how would you describe the administration's vision for the development of not just the health sector, but for Guyana as a whole?
Well, you know, we have in every sector, we want to make sure that we can develop the sector to be one of the best in the world. In health, that's what we are aiming to do. The president has said that, you know, our vision is to have a world-class healthcare system. And so we have been working towards that goal. You would see over the next month, next 2 months, not just the unveiling of projects, but the starting of these projects. So we have the pediatric and maternal hospital. That's a 256-bed hospital. That's going to start shortly. We have 6 regional hospitals that we're working on. And these facilities are going to be world-class facilities. They would be much better than things that we have currently. Better equipment, better facilities in which to work, better environment for patients. And while we are doing that, we are also training a lot of our human resource to be able to manage these facilities. So that's our aim. And while we will be starting these projects this year, by next year, we also have another set of projects that we have been working on. In addition to that, you know, we have this collaboration with Mount Sinai. And Mount Sinai is working with us in different areas. So one area is to improve the quality of our service. And with Georgetown Public Hospital, the team is going to collaborate there to bring some change management, and improve quality. And then that would trickle down to the rest of the system into the different hospitals. We are also looking at some other national programs that we're working with them, including diabetes care, and to have a more comprehensive system so that we can treat people, prevent some of these things from happening, and even if they have diabetes, to prevent the complications from happening. We are also looking at developing centers of excellence. So you will have an oncology center of excellence, a cardiovascular disease center of excellence. So these are all projects that we are working towards. And there's also a number of companies that have expressed interest in doing things in the biomedical realm. So they want to come here to set up things to manufacture pharmaceuticals. There's the possibility of setting up plants for manufacturing of vaccines, manufacturing of saline solutions. There are companies who have expressed interest in coming to set up facilities to do diagnostics. Companies who have expressed interest in coming to Guyana to do research, especially in tropical medicine. So there are lots of interests, lots of persons want to come here to do different things in medicine. And we ourselves, we want to use technology to be able to provide a better quality of care. So in the next 2 years or so, you would see us put in a new electronic medical record system. You will see us pivot more to the use of telemedicine, especially to improve quality of care in the hinterland community. This year we are starting a pilot in 4 hinterland communities using telemedicine. Once that works, then we will be able to adapt that more widely across the system. So there are lots of interesting things that are happening, and I think you would see tremendous leaps in the health sector over the next year, over the next 2 years, and certainly the end of 5 year, it would be a totally different health landscape from the one that we have inherited. And that's what we're working towards.
Dr. Anthony, I want to thank you for taking the time to have this conversation with me.
Thank you very much.
This has been The Journey to Prosperity for All. I am your host, Shaquan Gill, saying goodbye for now.